Well, welcome back, everyone. This is Dr. GERARD CUOMO. I'm here with June's case, and we've already hand tightened the upper right anterior first molar, first bicuspid. It is a screw retain. It is a bone level screw retain, single tooth prosthetic crown, implant crown, and we designed it a little bit further to the distal. With the access hole, and much of that came from surgery. So surgery kind of dictated. There was a huge little history about this case. There was a huge abscess up in the sinus wall, and the surgeon had to graft that site. I believe it was quite intense. So what he did was he did graft the site and got us to this point with the two implants. I believe that the soft tissue attachment looks quite adequate. I think she's got a lot of keratinized tissue all the way around, so you need that, for the layperson out there, you need to have that gum tissue, because tissue is definitely the issue. You've got to have enough coverage. Otherwise, you start to see the body of the implant later on and look very good. So, and plus it's not healthy. So you got to have good tissue. My surgeon did a great job for what he had to do, and I think in a subsequent video we'll look at the pre-op photos, x-rays, etc. We'll give you, the viewers, a chance to see her case before we finished with it. So okay, so we're going to unscrew the next component. Just okay, we're ready to lift out. Open up this a little bit wider. She does that. We'll get that out. This is identical to the other healing abutment. Okay, so what I like to do is I'll show you the crown before I put it in. Again, it's got good metal support for the contact zones, because we do not want to in any way cause issues in the interprox over time, because implants do not move. So we kind of warn our patients too about chewing on almonds. Make sure the almonds are softened. Make sure you're not chewing ice. Just make sure you don't hit anything too hard, because the teeth below it will do all the flexure, but implants don't. So you could chip porcelain, etc. over time, but that's no problem, because these are screw retained. We can easily take them out if we wanted to, fix them, put them back in. That's the beauty of non-cementing the cases. And also the tissue likes it better. Who wants to clean cement below the gum line? My gosh, it would just be a nightmare to try to do that. And on earlier videos we did show you the right technique, but we find that it's still, with the microscope, it's a challenge. It's not that easy. So we're looking straight down. Let's take a closer look at how healthy that socket is. Now we can thank our surgeon, Dr. John Lindsay, for this case. He did a great job. He's in Boca Raton. You can look him up as well. Soon to be linked to my website. He's doing an excellent job. And if you look all the way down inside the implant body, you're noticing that there's no fluids down in there. There's no blood in there. There's nothing disturbing the threads. It's clean. And that's what you want to see. All right. So let's see how well our lab did. And that's Lynn DePietro lab. They're actually in the building. And Linny is such a great person. She'll be happy to talk to you over the phone and about all of our cases. And we'll give you that information at another time. Okay, right now we're going to go ahead and just slowly put this in, and I engaged the implant. Crown, and now we're just going to hand tighten that in. And as I hand tighten, certainly that contact's going to start to tighten up. So I'm going to get to that point, and we'll then start to check occlusion. And June, is that tender at all? Okay, she said no. As you hand tighten, you're going to feel the threads, and as the threads start to engage, you'll feel some resistance. You want to be able to feel minimal resistance as you go through and hand tighten. Otherwise, you might be putting pressure on a contact or even on other porcelain on adjacent teeth, and you could fracture or set up microfractures to that. So hand tighten gently as it goes down. Maybe wait a little bit, let the tissue displace, and then you'll know as that tissue displaces, it'll get easier and easier to tighten the screw thread down versus trying to tighten it all at once, and then you could literally be putting so much pressure on the threads you could end up with a real problem where the threads will strip or the implant body will break over time. So you've got to do that very carefully. It's very important. Alright, so we'll be back at you for the finish. We've got a bunch of things we're going to do here. Just a quickie to show you how that next crown went in. And look at now, she's got teeth on that side. The color looks great. The line and profile of her bite. Let's just give you a little better look. There we go. And bite together, June. Okay, good. Yeah. Tissue adaptability here right up to the soft tissue, which is keratinized. That's what you want to see. And we're looking at this side to compare. I think we're doing a pretty good job. All right, Dr. Gerard Cuomo, I will see you on the next segment. Thanks for watching.